Here we'll talk about IMNCI, but before that, let us just see this IMCI, which is Integrated Management of Childhood Illness. It is developed by WHO and UNICEF. So this IMNCI is an Indian version of this IMCI, right? So let us see what is IMCI, the strategies of it, improvement of case management skills of health staff, improving in the health system, and also health practices in the family and the community, right? So even in the name you can see there is integrated management of childhood illness. So obviously we are teaching this health staff on how to manage a case properly. So what happens if the health staff are well taught? It will improve the health system and also healthcare practices in the community, right? So these are the strategies of IMCI. Note, integrated management of childhood illness, which was developed by WHO and UNICEF. We have an Indian version of IMCI, which is called IMNCI, right? So in case of this IMNCI, we are mainly focusing on this neonates. So let us see this Indian version of IMCI, which is IMNCI. So in this program, early neonates of 1 week old, 0 to 7 days of age are included, and also emphasis is given more on sick neonates compared to the sick older child. And then write about this training of health workers. And also IMNCI incorporates national guidelines on malaria, anemia, vitamin A, immunization and all. So this IMNCI, it looks beyond the treatment of a single disease. So it is a cost-effective program. It focuses on prevention, promotion and also curative aspects of the disease. So let us see what is the objective of this IMNCI. So this implementation of this IMNCI package at the house level. See what is happening in IMNCI. We'll divide the different conditions according to the severity into this pink group, yellow group and the green group, right? So green group are treated at home, yellow group are treated at PHCs and all, and this pink group are referred to district hospitals and all. So we are trying to manage this IMNCI package at the household level, at the sub-center and also at the PHC level. See, let us see the outpatient health facility. First we'll check for any danger signs in the person or the child, right? So we'll see for any convulsions or lethargy or unconsciousness in the child, inability to breastfeed, vomiting. So these are all the danger signs in the child, right? First we'll look for this danger signs and then we'll assess this main symptoms like cough, difficulty in breathing, diarrhea, fever, ear problems and all. Then we'll assess the main symptoms. Afterwards we'll assess the status, nutritional or the immunizational status and the potential feeding problems, right? So what are we doing here? First we'll checking for this danger signs, and then we are checking for main symptoms like cough, difficulty breathing, diarrhea, fever. What are the symptoms you'll take in the history? So you're checking for that, and then you're looking at the status. So DM status, right? So assessing the nutritional and the immunization status, and then check for any other problems if present, and classify the condition according to the color coded treatment. So we'll classify the conditions under these three things. One is pink, second is yellow, and the third is green. If the condition of the baby is classified under the green, you'll have to give this household treatment. If it is classified under yellow, you'll have to take the baby to the OPD. If it is classified in the pink, there is urgent referral. So let us see the three things. So under the green, you have this home management, right? So here the caretaker or the mother is counseled on giving this oral drugs and also treatment of this local infections at the home. So mother will be counseled by this ANMs or Anganwadi worker to treat the local infections at the home, to how to give this oral drugs and all. And mom is counseled to continue the feeding, and also she is said to when to return immediately to the hospital and follow up and all, right? So if the conditions are categorized under this yellow, you'll take the baby to the OPD. There also they'll treat this local infections. There also they'll give this oral drugs and advise and teach the caretaker like mom, and also follow up is done. So if it is pink, you have to do this urgent referral. So pre-referral treatment is given, advise the parents on how are you going to treat the child and all, and then refer to the emergency triage and the treatment, right? So ETAT, emergency triage and treatment. So you'll do the diagnosis, you'll do the treatment, you'll monitor the child, and also you'll follow up. So this is about IMNCI.